present Vivian.
Can you hear me in the back, Lisa? Okay, I need my glasses just a second. So, I'm Vivian Auld from the National Library of Medicine, and this is what our homepage looks like, and I'm very hopeful that this is not new to any of you, even though it's a new format. But I hope you're familiar with the NLM and the products that we produce. We are the world's largest medical library in the world. We provide services and information in all areas of biomedicine and healthcare. And you've probably heard of PubMed or the UMLS or the Visible Human. These are all products that we have put together. Specifically what I'm going to be talking about today is our role with interoperability and vocabulary standards. We are designated as the central coordinating body for clinical terminology standards within the U.S. We were designated by the Secretary of Health and Human Services, Secretary. And we make sure that we coordinate all of our efforts with the Office of the National Coordinator so that we don't inadvertently go off in divergent paths that will confuse everyone. We are the distributor of HIPAA classifications and code sets within the UMLS and other terminologies required for electronic health record certification. And we're the supporter and developer of several key terminologies. Since 1999, we have been supporting the free distribution of LOINC worldwide through a contract mechanism. We have been working with the direct development of RxNorm since it was started in 2002. And back in 2003, NLM established a contract and licensing arrangement with the College of American Pathologists, allowing the free distribution within the U.S. of SNOMED CT. And it was this model that we created with CAP that was used for creation of the IHTSDO, the nation membership. And we've been a member of the IHTSDO since 2007. So our relationship to the IHTSDO is we are a charter member. We are responsible for distributing SNOMED CT within the U.S., and we do so through the UMLS. And we also handle the licensing, the affiliate license for SNOMED. We have incorporated the IHTSDO affiliate license within the UMLS license. It's Appendix 2. And I realize this confuses some people. If you have questions, do not hesitate to ask us that. We serve on the General Assembly, and we're also, we have 2 representatives on the member forum. And at present, we're the chair of the General Assembly, and I'm the vice chair of the member forum. But this isn't all. You can barely see these. But these are all the people, all the parts of the IHTSDO management that we participate in. Not necessarily NLM, but the U.S. And it's important to realize that even though NLM is a government agency, we're not doing this to impose a process on everyone. Instead, what we're doing is facilitating access to SNOMED. So we do have a U.S. representative on the management board. We have elected people who are representing us on the 4 standing committees: the content, implementation and innovation, the quality, and the technical committee. And every summer we put out a call for nominations asking, do you want to serve on these, so that you can access it through that. And as Mark was mentioning, there's the affiliate forum, and as Jan-Erik mentioned, there's the working groups and SIGs. Those, if you're interested, just sign up. You can participate. In all of these cases, we really very much encourage your access and your participation. And the messages that we send out to people, we post all of these on our website, but we also will send messages to people who are the affiliates, who have a UMLS license. So if you want to know more, don't hesitate to get a UMLS license. It's free. It's painless. So I keep talking about the UMLS. This is the new face of the UMLS, the UMLS Terminology Services. This was released, I think, in November of this past year. And if you remember nothing else, remember this URL, because that is the key that gets you to everything. If you want SNOMED, this is where you're going to go to get it. If you want a license, this is where you're going to go to get it. You can get, once you have a license, you can get access to SNOMED either in what we call its native format, which is the format as it's distributed from the IHTSDO, or you can get it as part of the UMLS Metathesaurus. The Metathesaurus is a collection of roughly 150 terminologies, ontologies, classifications, code sets. They're all pulled together at a concept level, so that if you have one vocabulary that calls it myocardial infarction and another calls it heart attack, those are joined at a concept level. Through the UMLS, you can also get access to our new SNOMED CT browser. You can get access to all of the UMLS resources. And you can also get access to, that's the problem, my arrows have moved up. But I wanted to point out, is this one here, we are working on creating useful subsets of SNOMED for very specific purposes. And the first two that have been created are a core problem list of SNOMED CT. It's about 5,000 problems that are identified, and we also have a route administration subset that was released just a few months ago. And there's a nursing problem list that is also going to be coming out probably in a month or two. The SNOMED browser that I mentioned is very nice because it is built on the UMLS, so all that concept matching that I was talking about is used in the background to help aid your retrieval. So you can put in whatever term you're used to, and we'll use that knowledge to return the actual SNOMED term. So in this case, if you put in the term inflamed eye, it takes you to the SNOMED term, which is ocular hyperemia. So it helps get you to the actual term that you need. And it also is set up so that if there's nothing in SNOMED, you can use it to find out what other vocabularies that might be listed as standards in the US have that same phrase. We have been working on various other places where SNOMED can be quite useful. One of them is the Newborn Screening Coding and Terminology Guide, where we have identified subsets of key vocabularies, including SNOMED, ICD-9-CM, CPT. These are the standards that we want people to use for recording and transmitting newborn screening test results. And it's in an effort so that instead of everybody doing it completely different, so that across the country you cannot compare, you will now be able to start comparing the data. And we've also started working on Medline Plus Connect, which allows you to draw standard terms that are put into an electronic health record. For right now, you can use ICD-9-CM, SNOMED, or RxNorm, and it will pull back consumer-specific information that has been vetted by the experts in that subcategory. Information specifically for the patient. So if somebody is diagnosed with diabetes, it will automatically go through and produce information that you can give to the patient so they can find out more. We are working on people are always asking us about this. We're working on a SNOMED to ICD-10 mapping project. It will likely be created specifically to support reimbursement. This is being built on the work that the IHTSDO is already doing, the mapping SIG is already doing in relation to SNOMED to ICD-10. Because NLM never wants to do something that the IHTSDO has already done. We just want to build on it not waste our resources. So this project is being coordinated by NLM. We have representation from NCHS, National Center for Health Statistics. They're the folks who put together ICD TCM. We have Jim Campbell out of the University of Nebraska. He's also the chair of the IHGSTO Mapping SIG. And we're seeking participation from CMS so that we can make sure that it ties into all the meaningful use legislation. And so far, we have an overall project plan and use case, and we're building on what the IHGSTO is doing in the mapping area with their tools. And we're going to come stopping if we don't get funding soon. Is the blunt answer here. But you've all seen the news. The budget is going to be fun. We are very soon going to have to release the first version of the U.S. extension to SNOMED CD. And as I was saying, we don't want to reproduce anything that the IHGSTO has already done. So what you're going to find in our extension is if something is needed to support a specific clinical use case, and it is not appropriate for it to be in the international release of SNOMED, then we will put it into our subset. And that's going to be coming sometime in March. And directly tied into that is the new U.S. request submission system, which will be, it will have a web interface, and it will allow you not only to enter information, but to track its progress. And you'll be able to see what other people have requested. And back in a month ago, the IHGSTO announced the new policy wherein for specific purposes that are approved, you can distribute subsets of SNOMED, the names and the codes, without having to worry about charging from them. So you can use it anywhere in the world, not have to worry about being billed for it. This directly came from users saying, I want to use SNOMED for this purpose, but I can't. It's going to cost too much. And so all the powers that be within the IHGSTO put their heads together and came up with this solution. So I very much encourage you, if you have a place where you want to use SNOMED and you don't think you can for whatever reason, come talk to us, come talk to the IHGSTO, let us work with you to find a solution. And we're going to, on Tuesday, we're going to put up a related press release talking about how this is benefiting meaningful use and quality measures, which is what Floyd's going to be talking about. And then the other big news is CMT, which is what Mohin's going to be talking about. So this is all my contact information, and do not hesitate to call me if you have questions. Like I said, we want you to use SNOMED. If you think you can't for whatever reason, please come talk to us. We'll work it out.